Welcome back to part 2 of Neck Pain and Headache series. So let's talk about how some of these structures will support the head, and they may even generate or influence danger signals to the brain. Look at the bones first. Then we'll review some of the muscles and the nerves around the neck. Firstly, there's 7 vertebrae in the neck, with the head or cranium perched on top of C1 or the atlas. Deep in the neck, there are small muscles that assist with head movements, but more importantly, they are highly innervated with nerves which allow smooth coordination of the head and neck with the eyes by providing constant feedback on the position of the head. These nerves are called proprioceptors and are responsible in the normal function of the neck. However, they may stop working properly after an injury or in response to pain. Injury, pain, and immobility may result in a decreased function of these nerves. So the expression "move it or lose it" is very real here. We really need movement and activity to maintain healthy muscles and nerves. There is a nerve that travels between the first and second vertebrae in the neck, and this nerve arches upward towards the top of the head. We call this the greater occipital nerve. As the greater occipital nerve gets close to the skull, it actually pierces through a muscle called the semispinalis. This may be a culprit in tension headaches, as compression of this nerve may occur from this muscle, the semispinalis. The nerve then travels over the top of the head to the frontal lobe. Tension headaches tend to follow the same pattern as this greater occipital nerve, hence the association of tension headaches with compression or irritation of this nerve. Now, let's look at the simplified biomechanics of the neck. For this, let's review a simple lever or use a teeter-totter example. If we have a large person at one end and a smaller person, say a child, at the other end, in order to balance it, we need to move the axes. If we move the axis or fulcrum closer to the adult, we will then increase the length of the child's end, which will result in increasing the child's weight or resistance. This is exactly what happens with poor posture. Forward head or slouched posture will cause that increase in the lever length, making the head heavier and more difficult to hold up, resulting in increased resistance on the neck and the muscles around the neck. So the muscles of the neck really have to work hard in order to support the head and neck and maintain the upright position or posture this way. Okay, time for an activity. Clench your fist and squeeze it tight for 10 seconds. What happens? It blanches due to decreased blood flow in the hand. Remember, blood is not able to flow through a contracted muscle. This will result in decreased blood flow in the muscles until that muscle relaxes. So poor posture and a head-forward position means the neck muscles are going to be constantly contracting to hold the head upright, which may result in decreased blood flow and the generation of danger signals to the brain. In reviewing our anatomy, we can see other potential sources of danger signals which may be stressed with poor posture. Some of these sources include tendons, ligaments, joint structures, muscles, nerves, and even blood vessels. These may be stressed with trauma or receive long-term stress due to poor posture and will send danger or stress signals to the brain. One particular nerve that innervates muscles and structures of the head and face is the trigeminal nerve. This has parts of its central core or nucleus in the first 3 vertebrae. So mechanical problems in these joints may result in the referral of pain to the head and face, and even balance or equilibrium problems. Now let's talk about headaches. Classification of headaches has changed or continues to change or evolve over time, but I'll try to focus on three main categories as described by the International Classification of Headache Disorders. Headaches are broken into two major categories: primary and secondary headaches. Primary headaches are disorders by themselves. In other words, they're headaches such as migraines or tension headaches. Whereas secondary headaches are the result of another disorder that is known to cause headaches. Examples could be things like infections or neck dysfunction. In addition to these categories, there are also neuropathies and facial pain. These follow the distribution of nerves in the head or face and are considered separate from headaches themselves. An example could be trigeminal neuralgia. For our purposes, we'll review three subtypes of headaches: the tension headaches, migraine headaches, and cervicogenic headaches. Let's start with the tension headaches. These present as a dull pressure or a tight band that radiates from the forehead to the back of the skull or neck, and the pain may even spread across the ridge of the shoulders or the trapezius area. Conservative treatments have been shown to be effective in the treatment of tension headaches, and these include things such as physio or physical therapy, manual therapy, exercise, relaxation techniques, and behavioral therapies. Migraine headaches affect about 15% of the population, with a greater affinity for females than males. Symptoms of migraines are usually one-sided, pounding or throbbing pain, and associated with nausea or possibly even vomiting. Migraines are also associated with photophobia or light sensitivity and phonophobia or sound sensitivity, and are typically eased or reduced with sleep or rest. Medical management is the first line of treatment for migraines. However, physiotherapy may be beneficial to focus on posture correction and reducing external stresses. Cervicogenic headaches may last days to weeks, and unlike migraines, sleep usually does not assist or alleviate symptoms. These are usually or almost always localized to one side of the head or face, and are often periorbital, or in other words, around the eyes. Cervicogenic headaches are also associated with mild dizziness, lightheadedness, nausea, but they are not usually associated with vomiting. And these headaches are treated very effectively with manual therapy or physiotherapy, exercise, and posture re-education. Well, that was a brief review of neck pain and headaches. In our next session, it's going to be more practical, where I will be teaching you some exercises, posture re-education techniques, and even self-mobilizations that you can do in the management of your neck pain and headaches. I want to thank everyone for spending the time to hopefully learn a little bit about headaches and neck pain and gain a little knowledge in your self-management of neck pain or headaches. Thank you again.